Hey, Dr. Leo Krawetz here, a Healthy Feet Podiatry. I've got a follow-up case. This is a great case. It's a patient with a venous stasis ulcer on the ankle. And he's had this for a year probably, or more than a year, I think, correct? Yeah. So we've been treating this for at least 6 months, but I wanted to show you this because it's significantly smaller than before. So if you take a look at the wound, I want to point a couple things out here on this wound. This is the main part of the wound right here. And what I'm doing is called a dermabrasion right here. I'm actually pushing pretty hard, and this can stimulate it to bleed a little bit, and that's what I want. The bleeding actually tells the body, hey, there's damage going on here. We need to heal it, send a lot of the blood to the area because of the stimulation of this granular tissue right here. And then it causes the wound to start contracting and to heal. So this has been going on a long time, but if you look, the thing that I wanted to point out was this area from my right here where my pinky is, down here is all healed skin, but it's all macerated erythematous, which means red. So red, wet skin that's very irritated because the blood it keeps pooling down there and it's not going back up to the heart fast enough. So that's another issue. So this patient puts compression on this wound after he puts a dressing on there. He'll put the compression dressing on there to help push the blood back up. So it's a slow process. Sometimes this can take 2-3 years to heal. And in his case, that's probably what it's going to take 1 to 2 years for him to heal. But it is healing and it is much smaller. This will probably bleed quite a bit right there. You can see where I cut that tissue. And what I'm doing is basically cutting tissue or getting rid of dead skin, but which will make it bleed because of the underlying granulation tissue that you can see how it's flowing pretty well there. But I'm doing that to stimulate it and stimulate tell the body, hey, let's heal this area here. It's been working. He comes in every couple weeks, and this is what we do, and it slowly gets better. So the patient also complained of irritation here, that it's itching and really irritated down here, and that's because of the dermatitis. That's where they get the term venous stasis dermatitis from. The blood pools there, and it causes the skin to drain and weep, and then it becomes really inflamed and it itches like crazy. So I'm gonna let him use cortisone 10 cream on the area. I'm gonna show you this area here. Let me try to cauterize this so you can see it better. I know I've got this on it. Look, you can see the wound. If you look up close, you can zoom in on that, Alexia, so we can see what the wound bed itself looks like up close. But I'm gonna let him use cortisone 10 on that area. So I'm gonna put this on here so you can actually see. On the area down here, we'll put cortisone 10. It's 1% hydrocortisone, so it's not real powerful steroid. It can slow down the healing if it's used too much, but it will stop the itching and the irritation to some degree. The main thing is trying to dry this out and to keep the swelling out of his foot, and that's gonna be with the compression. So right now what I'm doing is trying to get this to slowly stop bleeding, and this will bleed a lot at first, but eventually it's gonna stop. And I'm looking at the picture myself to see, and up close you can see all that beefy red tissue, and that's all granulation tissue there, and that granulation tissue eventually is gonna close up. So I just wanted our audience to get a good look at this to see what it looks like up close, what a venous stasis ulcer looks like. These can be debilitating for the patient, but he actually gets around. He's able to walk and function in his normal everyday life, right? And it's just a huge nuisance right now, but eventually we'll get it healed up. And the key is gonna be keep the swelling down, because every time it swells, the skin's gonna get thinner and it's gonna break down again into one of these ulcers. But so far, so good with this. So I'm gonna cover this up. We're gonna put a dressing on it and some compression on it. He'll come back in 2 more weeks, and we'll do an update in a couple months to see how much smaller it is. But right now it's about half the size. Even though it looks bad, it's looking way better than it did a few months ago. And if you look in our videos, you can scroll down in our video section and see a previous video possibly of this where we have the ulcer where it's about twice the size of this. If you like what you see, you can subscribe to our YouTube channel or go to our Instagram page and follow us on Instagram. Thanks.